Medicare coverage of durable medical equipment, presented by the Area Agency on Aging 1B Michigan Medicare Assistance Program, or MAP. What we will cover. We'll cover who we are and what we do. Durable medical equipment. What is Medicare? What is durable medical equipment, or DME? How can I get it covered? And where do I get my DME? The Michigan Medicare Assistance Program, or MAP, our counselors are certified and have been trained in healthcare benefits counseling. This includes Medicare, Medicaid, and other insurance products. We counsel for Medicaid when the client has Medicare as well. MAP counselors are not connected with any insurance companies, and they are not licensed to sell insurance. In many states, MAP is called SHIP, or the State Health Insurance Assistance Program. How can a MAP counselor help you? We can help you understand your Medicare health plan, compare and enroll you in Medicare Advantage coverage, compare and enroll you in Medicare prescription drug coverage, help you identify and report Medicare and Medicaid fraud and scams, and assist you with enrollment to low-income programs like LIS, low-income subsidy, extra help, and Medicaid. Understanding Medicare. What is Medicare? Medicare is insurance for people 65 and older, people under 65 with certain disabilities, and people at any age with end-stage renal disease. It's administered by the Centers for Medicare and Medicaid Services, or CMS. Enrollment is through the Social Security Administration for most people, or the Railroad Retirement Board for railroad retirees. Medicare has well-defined benefits and exclusions. It does not cover dental, hearing, or vision except under special circumstances. It does not cover long-term custodial care. It places limits on certain care items such as physical therapy and durable medical equipment, and it does not cover over-the-counter medications. Medicare works with private insurance companies to provide Part D prescription coverage, supplemental or Medigap plans to fill in the gaps in original Medicare, which is Parts A and B, and Advantage plans that combine parts of original Medicare, usually with prescription drug coverage, and often some dental, hearing, and vision coverage. There are 4 parts of Medicare. Part A is hospital insurance. Part B is medical insurance. Part C are Medicare Advantage programs like HMOs and PPOs, and Part D are Medicare prescription drug coverage programs. Durable medical equipment. Durable medical equipment, or DME, is equipment that helps you complete your daily activities. It includes a variety of items, such as walkers, wheelchairs, and oxygen tanks. Medicare usually covers DME if the equipment is durable, meaning it can withstand repeated use, serves a medical purpose, is appropriate for use in the home, although you can also use it outside the home, and is likely to last 3 or more years. To be covered by Part B, durable medical equipment must be prescribed by your primary care provider, or PCP. If you are in a skilled nursing facility or in a hospital inpatient, DME is covered by Part A. Whether you have original Medicare or a Medicare Advantage plan, the types of Medicare-covered equipment should be the same. Examples of DME include wheelchairs, walkers, hospital beds, power scooters, portable oxygen equipment. Under the durable medical equipment, prosthetic, orthotic, and supplies category, Medicare Part B also covers prosthetic devices that replace all or part of an internal body organ, prosthetics like artificial legs, arms, and eyes, orthotics like rigid or semi-rigid leg, arm, back, and neck braces, and certain medical supplies. Part B also covers certain prescription medications and supplies that you use with your DME, even if they are disposable or can be used only once. For example, Medicare covers medications used with nebulizers or lancet and test strips used with diabetes self-testing equipment. To find out if Medicare covers the equipment or supplies you need, or to find a DME supplier in your area, you can call 1-800-MEDICARE or visit www.medicare.gov. You can also learn about Medicare coverage of DME by contacting your local state health insurance assistance program or MAP at 1-800-803-7174. There are certain kinds of durable medical equipment and supplies that Medicare does not cover, including the following. Equipment mainly intended to help you outside the home. For example, if you can walk on your own for short distances, enough to get around your house, Medicare does not cover a motorized scooter that you only need outside the home. Most items intended mainly to make things more convenient or comfortable. This includes stairway elevators, grab bars, air conditioners, bathtub, and toilet seats. Items that get thrown away after use or that are not used with equipment. For example, Medicare does not cover incontinence pads, catheters, surgical face masks, or compression leggings. However, if you receive home health care, Medicare pays for some disposable supplies, including intravenous supplies, gauze, and catheters as part of your home health care benefit. Note, catheters may be covered as a prosthetic if you have a permanent condition. Medicare does not cover modifications to your home, such as ramps or widened doors for improving wheelchair access. Note, some Medicare Advantage plans may cover minor home modifications or other items as an extra benefit. Medicare also does not cover equipment that is not suitable for use in the home. This includes some kinds of durable medical equipment used in hospitals or skilled nursing facilities, like paraffin bath units and oscillating beds. Keep in mind that Medicaid may cover some forms of equipment that Medicare will not cover. Getting Medicare coverage for durable medical equipment. Whether you have original Medicare or a Medicare Advantage plan, Medicare covers your durable medical equipment if you meet the following two conditions. 1. Your primary care provider must sign an order, prescription, or certificate. In this document, your primary care physician must state that you need the requested durable medical equipment to help a medical condition or injury. The equipment is for home use, and if applicable, a required face-to-face meeting occurred. Your face-to-face visit, when required, must take place no more than 6 months before the prescription is written. Your provider should know if Medicare requires a face-to-face visit for the item you need. A full list of items subject to face-to-face meetings for Medicare coverage can be found in a master list that your physician should have. 2. Once you have your primary physician's orders or prescription, you must take it to the right supplier to get coverage. Be sure to only use suppliers with approval from Original Medicare or your Medicare Advantage plan. Please note there's a different process if you need coverage for a manual or power wheelchair or scooter. If you have Original Medicare, you should get your DME from a Medicare-approved supplier that takes assignment. You can call 1-800-MEDICARE or your MAP program for a list of these suppliers in your area. When looking at suppliers on Medicare.gov, Medicare-approved suppliers that take assignment are noted with a $sign icon. Be aware that many suppliers are Medicare-approved but do not take Medicare assignment. These suppliers may charge you more than Medicare's approved amount for the cost of items and services. Medicare will still only pay 80% of the approved amount, so you will be responsible for any additional costs. Avoid suppliers who don't contract with Medicare because Medicare will not pay for these services you receive. This means you will be responsible for the entire cost. Medicare Advantage coverage of durable equipment. If you have a Medicare Advantage plan, you must follow the plan's rules for getting DME. Your plan may require that you receive approval from the plan before getting your DME. Use a supplier in the plan's network of suppliers because you may get little or no coverage if you use an out-of-network supplier. They may also require you to use a preferred brand, and you may pay higher costs when using a non-preferred brand. So please make sure that you contact your plan before getting your equipment so that you understand their rules. Costs associated with durable medical. Renting or buying durable medical equipment. Depending on the type of durable medical equipment you need, Medicare may require that you either rent or buy it. Most equipment is initially rented, including many manual and power wheelchairs. Original Medicare, Parts A and B, covers 80% of the cost of a monthly rental fee for 13 months, and you owe 20% coinsurance. If you have a Medigap plan or a Medicare Advantage plan, those costs may be different. After 13 months, ownership is typically given to you automatically. In certain situations, you may have to buy your DME. For example, Medicare may require that you purchase an item that is made to fit you. Original Medicare would cover 80% of the approved amount of the cost of equipment, and you would owe 20%, unless, again, you have a Medigap or a Medicare Advantage plan. Medicare allows you a choice as to rent or buy certain items, such as power wheelchairs, items costing less than $150, and parenteral or enteral infusion pumps. Note, there are different rules for oxygen equipment. Repairs and maintenance of durable medical equipment. Your DME may at some point require repairs and maintenance from your supplier. Repairs by a supplier involve fixing equipment that is worn or damaged. Maintenance means checking, cleaning, and servicing your equipment. If possible, you are expected to do regular maintenance yourself using the owner's manual. However, a supplier should perform maintenance if the task is more complicated and requires a professional. Medicare's coverage of more specialized DME repairs and maintenance depends on whether you or your supplier owns the equipment. Renting DME. As long as you are paying a monthly rental fee for your equipment, your supplier must perform all needed repairs and maintenance when a professional is required. The supplier cannot charge you for this work. Owning DME. If you purchased your equipment or otherwise own it, Medicare covers needed repairs and maintenance when a professional is required and the services are not covered by warranty. Please note, there are separate rules for repairs and maintenance on oxygen equipment. Medicare generally only covers the most basic level of durable medical equipment to meet your medical needs. If you want features or upgrades, you may have to pay for them out of pocket. For example, Medicare will cover a power wheelchair that you need for home use, but if you request a special backrest or tilt function that is not medically necessary, you may need to pay for those features yourself. That said, Medicare may pay for special features or upgrades when your doctor includes them in your DME order or prescription. In this case, your doctor should explain why your health condition justifies the additional feature. For example, if your doctor states that you do not have the strength or balance to lift a standard walker without wheels, Medicare should pay for a model with wheels. If your supplier thinks that Medicare may not pay for additional features or upgrades, the supplier should have you sign a waiver form called an Advance Beneficiary Notice, or ABN, before you get the item. On the ABN, you must check the box stating that you want the upgrades and agree to pay their full cost if Medicare denies coverage for them. Even if Medicare refuses the upgrade, it should still pay the amount that it would have paid for the basic model of equipment. You will then receive a bill for the remaining cost. If Medicare refuses to cover upgrades and the supplier fails to provide you with an ABN, you do not owe the supplier for the added features. Medicare will pay to replace equipment that you rent or own at any time if it is lost, stolen, or damaged beyond repair in an accident or natural disaster, so long as you have proof of the damage or theft. Replacing equipment means substituting one item for an identical or nearly identical item. For example, Medicare will pay for you to switch from one manual wheelchair to another, but it will not pay for you to replace a manual wheelchair with an electric wheelchair or motorized scooter unless your condition has changed and an electric wheelchair or motorized scooter is now medically necessary for you. If your equipment is worn out, Medicare will only replace it if you have had it in your possession for its whole lifetime. Medicare, to be eligible for a DME replacement, your primary care provider must write you a new order prescription that explains your medical need. It is most cost efficient to use a Medicare-approved supplier who takes assignment. Keep in mind that you can only receive Medicare coverage for one piece of equipment that addresses at-home mobility issues. Your PCP will determine whether you need a manual wheelchair, a power wheelchair, a scooter, or a different device based on your condition. Once you have your PCP's order prescription, you must take it to the right supplier to get coverage. If you think you need a mobility device, first speak with your primary care provider. If they determine that it is medically necessary, they should sign an order, prescription, or certificate after a face-to-face visit. The order should say the following: your health makes it very hard to move around in your home, even with the help of a walker or cane. It is difficult for you to perform activities of daily living in your home. You can safely use a manual wheelchair yourself or always have someone to help you use it. Or with a power chair or scooter, you cannot use a manual wheelchair but can safely use a power wheelchair or scooter. It will help with a specific medical condition to be used in the home, and you have had your face-to-face visit. If you have original Medicare and need a power wheelchair or scooter, your provider or supplier should first contact Medicare and find out if you need to request prior authorization. Prior authorization means that Medicare must be asked for permission before you can get a certain service or item. This requirement only applies to certain power wheelchairs and scooters. Please note, if you need a power wheelchair or scooter that is not subject to prior authorization requirements, you may instead need to sign an order from your PCP or for original Medicare to cover the device. Medicare's coverage rules for oxygen equipment rental, repairs, and maintenance are different from its rules for other forms of durable medical equipment. Note that covered oxygen equipment includes portable oxygen tanks. Keep in mind that you should still use the right kind of supplier to limit your costs. Unlike other types of DME, oxygen equipment is always rented in a 5-year cycle, and you never have the option to buy it. Medicare will pay the supplier a monthly rental fee for the first 36 months. The fee includes all equipment, oxygen supplies, and maintenance. You owe 20% of each month's rental fee unless you have a Medigap plan or Medicare Advantage, which may have different rules. After the rental period, you pay no more rental fees, although the supplier still owns the equipment. You keep the equipment for up to 24 additional months. If you use oxygen tanks or cylinders, you will continue to owe the coinsurance for each month. You will also owe coinsurance for any needed maintenance during these additional months. At the end of 5 years, you will have the choice to either get new oxygen equipment from your supplier or switch suppliers. If you need oxygen equipment for less than 5 years, the supplier will take it back after you no longer need it. Medicare fraud, errors, and abuse involve a wide range of behaviors that result in unnecessary costs to the Medicare program. It is important to recognize potentially fraudulent activities by providers and DME suppliers. Some examples of DME fraud and abuse might include a supplier who wants you to use their doctors rather than your own. These doctors may then prescribe unnecessary medical equipment. Or if someone steals your Medicare number and uses it to bill Medicare for DME that you do not need and/or was never delivered. Someone calls you or visits your home to offer you free equipment that you do not need and then bills Medicare for the equipment. For example, you might receive a phone call from a telemarketer who asks if you are experiencing any pain. If you say yes, the caller may ask for your personal information, like your Medicare number, so that they can send you a knee or back brace to help with the pain. This is likely a fraudulent call, and you should not provide the caller with any personal information. If you receive a call like this, contact your senior Medicare patrol, which in Michigan is your MAP program, for assistance in reporting it. Other examples are beneficiaries who willingly allow their Medicare number to be used in exchange for money, gifts, or unnecessary equipment and supplies, or a DME supplier that bills Medicare for more expensive equipment or supplies than you were provided with, or if the supplier continues to bill Medicare for equipment that you have already returned. Remember the rules about Medicare's coverage of DME. Medicare should only cover DME that your doctor has certified that you need. There must also be documentation in your medical records supporting your medical need for the equipment and supplies. If you do need durable medical equipment, ask your doctor about whether you meet the coverage requirements to get it. If you do, get your DME from a supplier that accepts Medicare assignment, or if you have a Medicare Advantage plan, from an in-network supplier. Please be aware of aggressive marketing that tries to persuade you to change DME suppliers. Never sign a blank form from your healthcare provider or equipment supplier. Before making a decision to change suppliers, speak with your doctor and your current supplier to see if there is a need for you to change. Do not accept money, gifts, or unnecessary equipment and supplies from a supplier in exchange for your Medicare number. Do not respond to ads that offer free equipment to Medicare beneficiaries. Be skeptical of offers that seem too good to be true, and do not give any personal information to someone who comes to your home offering DME that you did not ask for. Protect your Medicare number. Only give your Medicare number to your doctors or other trusted providers. Check your Medicare summary notices if you have original Medicare, or your explanation of benefits if you have a Medicare Advantage plan, and billing statements regularly. Carefully look for any suspicious charges or errors. Also, remember that providers are not permitted to routinely waive cost sharing or offer gifts or financial incentives for you to receive services from them. If you see any suspicious charges or have any reason to believe your biller is billing inappropriately, call your provider to see if they have made a billing error. If you suspect healthcare provider DME fraud, contact your senior Medicare patrol, which again is your MAP program. And we can be reached at 1-800-803-7174. We are here to help you. Leave a message on our voicemail if no one answers. We primarily run on part-time staff, but we'll get back to you with a day or two. We counsel over the phone and on Zoom, and are also doing some services in person. Our service is confidential and unbiased, and no question is too trivial, and we often deal with very complicated issues as well. For more information, here's our phone number and Medicare.gov and more information. Here's our mandatory funding statement. And here's my name and contact information for me. Thank you.